It is one of the most common procedures for women in the United States today. More than 700,000 hysterectomies are performed every year in the United States. And while millions of women have successfully undergone this procedure, and studies have proven its effectiveness, there are still many commonly held myths and misperceptions surrounding it.
The concerns that women have when we talk about hysterectomy, obviously it's a major surgery, and that's not a myth, it is. But a lot of women think it's done with a large incision on their abdomen. And the truth is it can be done with very small incisions, less than a ½ an inch long, usually 3 of them on an abdomen. When a woman has a period, the flow comes from the uterus, and her hormones come from the ovaries. And when we decide to do a hysterectomy, we can talk about keeping the ovaries so they continue to have their hormones produced, and only removing the part of their female anatomy, specifically the uterus, that's causing the problems with their bleeding. The other myth that women have is that when you have a hysterectomy, it automatically means that you're in menopause. And women sometimes confuse having a period with hormones. They're two separate things. Hysterectomy is not a catch-all for everything that's female. I think we'll pick and choose parts that will be tailored to their problems. Certainly if you have issues with your ovaries, for example, maybe you've got a family history of ovarian cancer, or potentially you've got pelvic diseases like endometriosis that may require that we have to consider removing the ovaries, or certainly if you have an abnormality on the ovaries, we have to remove those. Another myth that women have about hysterectomies is they think it will negatively impact their sex lives. And the truth is that the studies show that women who have hysterectomies often have no change in their sex life or an improvement in their sex life.
Dr. Basinski also says many women rely more on their emotions and other irrelevant factors instead of facts when considering a hysterectomy.
I think some of the factors that go into why women sort of just take the word of whatever their doctor says is that gynecology is a really unique field. We deliver babies for women. We become very intimately involved in their lives and their families, and there's a trust with your gynecologist obstetrician that really doesn't exist with very many other doctors. So when you have a female problem and your doctor says, well, you need a hysterectomy and we're going to have to open you up because we can't do it because you had a C-section or whatever the issue may be, women just say, okay.
The medical community believes it's important to dispel the myths surrounding hysterectomies and to help women understand the different methods available today. Traditionally performed through the abdomen, hysterectomies are now performed using minimally invasive techniques that are safer and require less recovery time.
If we can do them with small incisions, we can reduce the risk of infection, we can reduce the risk of prolonged healing, we can get you back to work sooner, and the pain is certainly less if we can keep a procedure laparoscopic or robotic versus making a large incision. Unfortunately, in the United States, it's reported that around 75% of women still have a hysterectomy in which they make a large incision on the abdomen. And that's a tragedy to me, because women can have laparoscopic, minimally invasive hysterectomies almost universally. There are very few women who don't qualify to have a minimally invasive surgery. They'll often be told, if you've had a C-section, you can't have a laparoscopic hysterectomy. If you have large fibroids, you can't have a laparoscopic hysterectomy. If you've had endometriosis, all of those conditions do not preclude a woman from having a laparoscopic hysterectomy.
I recovered quite quickly. I didn't have any pain. I don't know if I have a high pain tolerance, but for me personally, I was ready to come out after surgery and go home. The procedure itself was easy. I came in at 7 in the morning, had my procedure done at 7:30. I was home by 7 o'clock that night. I had very little pain the day of surgery. The day after surgery, I probably took 4 pain pills, and it was at the urging of my husband, not because I really had very much pain. I did not.
While these types of techniques provide a better option for many women, Dr. Basinski recommends a hysterectomy should only be performed after other conservative options have been exhausted.
I want to try to figure out other ways that we can help them without ever getting to the fact that we have to choose a hysterectomy to solve their problems. I want them to have options. They can choose to use hormonal products that may decrease their blood flow. There are IUDs that we can place that can control blood flow. Certainly another technology that has been around for a few decades now is ablation. Ablation is a procedure in which we take a device that conforms to the inside of the uterus, and we're going to heat the inside of the uterus. We can destroy that lining and prevent it from growing back. And if it doesn't grow back, you're not going to have a period.
Board-certified physician Dr. Cindy Basinski and her expert medical staff are dedicated to providing GYN solutions to women that produce less risk, recovery, and pain while solving all of their medical concerns.
Dr. Basinski is the greatest. She listens to your problems. She treats you like a friend. She doesn't treat you like a number or a patient. She's concerned about everything in your life. She looks at the whole picture. She doesn't just see the problem. She looks for a solution to help you through everything that you have planned for your life. And if it gets cut short, she helps you through that also.
Dr. Basinski is based in Newburgh, Indiana, and runs her practice under the philosophy that every woman is important, deserves respect, and that her time is valuable.
When I endeavored to start my practice 10 years ago, I really had a vision for what I think medicine could be. And I thought it could be more than just white walls and a clinical setting. I wanted to make it more like what it was 100 years ago when you would go to your doctor's home to be seen. And I wanted to create an environment that was like a home or a spa. And when you came in, you got a robe. You could sit in a robe and you would feel taken care of. We have lamp lighting, so there's not fluorescent lightings that can make you feel tense and stressed. When you check in, you get seen about the time that your appointment is. I'm not going to have you sit in a room for 30 minutes to be seen. I want you to be seen right away. I want you, when you call in, you get a human voice to answer the phone, to take care of your problem, and you're not put through some type of system to get to somebody and then sent to an answering service. You want to be taken care of then, and you want to know somebody's there to take care of you. And that is really the philosophy of my practice. How can we take care of you and treat you well?
I recommend Cindy Basinski really on a number of levels. I have watched her in the operating room, observed her techniques. She is a good surgeon, she's a good physician, and she's a wonderful person. So I can really recommend her on all three of those levels.
I recommend Dr. Basinski's practice because of her whole staff. They actually care about you as a person, not just coming in, treating the problem. You come in here to her office and you are walking into home. You're walking into a group of ladies that are awesome. From the front to the back of this office, they are wonderful women.
For more information about Dr. Cindy Basinski, visit drbasinski.com, board-certified physician.